Okay, so the coronavirus has become a hot topic in the last few months, starting in a lot of European countries on that side of the globe, and then it sort of hit the United States last in a way. And with this dashboard and story, we're going to discuss the different effects in a way, how many confirmed in comparison to others, who's had restrictions, and where we might go from there. We're going to start with how large the United States is in comparison and how that's affected the spread of the virus in its numbers. So here we are in the United States, and the total of confirmed cases, the total deaths, and then the United States deaths. It's a big gap because there's a lot more of an area within this country, and that really affects it. Let's see, we can see here just how much, and then there's just a lot of other smaller countries within this. And then, let's see. Okay, and then it's forced the globe, this virus, to shut down in just the short matter of time to respond in an attempt to slow the virus from spreading to everyone and affecting the population completely. Streets have been empty, activities canceled, businesses have shut down in response to hoping to not have as many casualties as we would if we would remain open. Some countries have done a lot with restrictions and quarantine by shutting down cities and national quarantine with only essential workers such as those in healthcare, food distributors, and factory workers remaining employed to help sustain the essential items needed. Certain governments have formed the stimulus bills and suspended actual bills like rent, that kind of thing, to help sustain people with a way to pay for items while also remaining inside, away from the rest of society, so that we don't spread the virus. Masks have become the new norm when getting items and in small gatherings. And how to wash one's hands have become a major topic of discussion because it's just another way on how to kill germs and bacteria and help us sort of slow the spread as best as we can. Other guidance has come out, suggestions on how we can help protect ourselves and our family. Some of these states are the ones that have lockdowns. The red ones have not had any lockdown measures implemented, while the blue do. And obviously a lot of countries have taken this step to try and slow the spread. Since the United States didn't really start getting the coronavirus until later, they didn't begin shutting down businesses and schools until the middle of March, pretty much. When other countries began shut down way before this. Some states within the United States have taken good measures, while others have lagged behind, keeping businesses and schools open, and numbers show that for each individual state. States just such as Tennessee, Florida, some of those states, too, have even already begun reopening. Some countries are still not planning on reopening or lifting their quarantine. countries like Germany have already attempted lifting restrictions, but spiking cases, they returned with even stricter restrictions, and closing everything is damaging to the economy, but we need to figure out how to slow the spread while not creating a window for a recession, but not putting the population in danger. Let's see. Here's just sort of a sum of cases within weeks, how many have been confirmed from January up until March. Let's see, North America started with 8, and then it's jumped pretty quickly. It's got a lot of the darker blue due to having more. And this is in part to some of the states having a higher, a higher population, such as New York. They've had 10 million. Their population is pretty large in comparison to others. Wyoming has 16,000. Montana 17,000. Let's see, Florida 1 million. Tennessee 347,000. Just some of these more populated areas have many more cases than these smaller populated areas of the country. This map expands across the globe, so you can kind of see certain, not sure why that's in there, certain other areas and how many cases they've had. All right, back to the restrictions. Small businesses have been faced with the decision to completely shut down and not reopen due to closing and losing the money that they would have had if they had been able to open. The cease in sales for their businesses have created those consequences no one could have thought would happen before. And shutting these communities down has slowed the spread of the virus, as we can see, because it has plateaued off while we have remained closed. And while this is good, we still need to find a way to keep our economy going without people becoming infected. There are scientists working to develop this vaccine, but like the flu, it has different strains that will develop, so there needs to not only be a vaccination, but also immunity built up so that people become less susceptible to getting sick. Reopening can obviously improve the strength of immunity people have in response to encountering the strain, but at what cost due to people being asymptomatic, showing no signs? How do we continue to protect ourselves when we're unaware that we've been exposed by a family or friend? And we're using our resources as much as possible with testing centers and hospitals remaining vigilant and active to treat as many people as they can that are lined up, hoping that they don't have this virus and that they're not infecting anyone. Let's see. Here's just a little bit more on restrictions. Here's a little bit of everything in one, so you can review everything and look at the regions, restrictions, how many cases have been confirmed, the lockdown. But while we're in quarantine, immunity, as this lockdown continues in some areas and it's lifted in others, some people are going to be exposed to this bacteria and start getting a stronger immune system. We also need to focus on not only how to guide our countries and its populations, how to help them become immune, but we need to help guide those with their pre-existing conditions that are more susceptible to coming into contact with this virus and being affected by it the most. Due to their weakened immune system, we need to focus on what we do know and how we can help them. We need to have a continuous plan in effect to protect as many as we can. I think we need to do more than mandate and suggest, because while these suggestions are good, they are simply not enough. If you go to certain websites like WHO, they have preparedness and response plans that can help. They're focused to coordinate across regions to assess, respond, and mitigate risk. They also have the plan to improve country preparedness and response and accelerate research and development. There needs to be continual awareness of how to maintain the spread of the virus if the globe attempts to reopen and return back to normalcy that was before this virus became a daily topic of discussion. We need to continuously examine our data as we continue through this pandemic to ensure we are making the correct choices for ourselves, our family, and our friends. There's not very much data on reopening due to not many countries beginning to reopen yet. Most of the states in the United States have just reopened maybe a week or two ago. And beaches just opened up a couple weeks ago. We're probably going to get more data from that. After collecting that data, we need to see how many individuals have been infected, confirmed, and how many have died, and compare that to the data we have from when we were in quarantine. This can help us see if reopening everything is a okay idea or not. Because while we are in quarantine, cases are still arising, we are still having deaths, and no one still feels comfortable going outside of their home, but they still need to in order for essential items. I think with a little bit more time, studies, and task force, we can become prepared in our response to end this pandemic as long as we work together.